And good morning. Today is April 22nd, 2020, and this is our daily news for the day. Lots of crazy things happening in the world, a really interesting time to be alive. Let's start with what I think is the most craziest, and that's Kim Jong-un. Where is Kim? Okay. The leader of North Korea, dear leader as he is called, has disappeared. He has not been seen in public for almost 2 weeks. The expectation was that he would be at the celebration of his grandfather's birth. His grandfather was the founder of North Korea, and so everybody thought he would be there. He didn't show up. Then Monday night, the story came out that he might be in grave danger because of his health. He was last seen entering a hospital. He's overweight and he smokes, doesn't get much exercise, and he's already had heart problems before. So here it is, this 37-year-old leader of North Korea who's out of sight. Nobody knows where he is, what's going on with him. So it's really interesting to see how that will develop. President Trump was asked about him yesterday, and President Trump says, I don't know where he is. So anyway, we will see what's going on with Kim Jong Un. That could change all sorts of dynamics if he dies, if he has any health issues that lead to his premature death. That changes a lot of stuff in terms of the strategic alliance, United States, China, Russia. Who would have control of North Korea? Who is the successor? We don't have any idea. Okay, I'm not sure they do. They don't have a secession plan. Okay, all right. Next thing to talk about, let's just go straight to it. Oil. Price of oil since we were last here just went crazy. Oil is sold, it's produced, and then traders come in and take that oil that is pumped out of the ground and they trade it. Okay, they trade it to refineries, they trade it to big companies, they trade it to different countries. So, and it's that price of oil that has just gone crazy in the last couple of days. In fact, on Monday, the price of oil dropped, and we're talking about West Texas Intermediate oil, and it's sold by the barrel. Okay, West Texas Intermediate actually went negative. It went so low, below zero. It went $37 below zero, where people were basically saying, "Here, I will pay you. I will pay you to take this oil off my hands." So instead of selling the oil, they're paying people to get rid of the oil. Okay? Never happened before in the history of oil. We've been selling oil for more than 100 years. That has never happened. Okay? So on Monday night, the price of oil was a negative $37. And just crazy. There is simply too much demand. Too many countries are producing oil. Too many people in the United States are producing oil. And there isn't any demand for the oil. So the supply of oil is outpacing the demand for oil. We're not driving as much. We're not flying as much. Boom. The price just cratered. It's come back a little bit since then. And here it is. It's about 8:30 today on the 22nd, and I just saw an alert that says that it seems to be stabilizing a little bit. It's now above zero. When it closed last night, it was about $10 a barrel. By the way, to make a profit, a company needs to sell oil at about $40 to $50 a barrel. $10 a barrel doesn't do it. There are massive layoffs taking place because of the price of oil. It's a really, really scary situation. Okay? And why is all this taking place? Of course, it's because of the coronavirus. So the latest numbers worldwide, 2.5 million people around the world have the coronavirus. 178,000 have died around the world. In the United States, let's just get to it, 826,000 people have the coronavirus and 45,000 have died. That's more people that have died in the last 6 weeks, 8 weeks, than died in all the Korean War. Okay. And we're soon going to be approaching the deaths in the Vietnam War. Now, state of Texas, there's 20,000 cases, the governor announced yesterday, and there's 517 deaths so far. Here in the city of Abilene, there's 164 cases. Yesterday, it was 144. So it's gone up 20 cases in one day. In some places in the United States, the rate of deaths has peaked, plateaued, starting to come down, especially New York City. That's not the case in the rest of the United States. The rest of the United States, we're just still climbing up there. Here in Texas, we're still climbing up. One estimate is that we're not going to see our peak until early May. And it's possible, looking at these numbers, that might be the case. Okay, so Surgeon General yesterday announced that he is concerned that we're going to peak and then we're going to come down as we get into the summer. And then he said the flu season, starting November, December, the virus is going to come back, and it's going to be the flu season plus the coronavirus season. And it is just going to be much worse November, December, January than it was what we're going through right now in April. So that was a little scary to note. Couple things. One is that people have been tracking deaths in various places where the coronavirus has hit. New York, a lot of countries in Europe. And what they found is that the number of deaths that have occurred is about 25% more than what would be normal. And I bring this up because a lot of people say that the people who are dying of the coronavirus were going to die anyway. Okay? They're just dying because of this rather than something else. Well, that's not the case. Turns out that people are still dying of those things. Plus, you have these additional deaths. In New York, it's 200% more than what would be expected. So, the coronavirus is a deadly, deadly thing. Also, California, Santa Clara County announced that they have conducted autopsies on some people who died in early February, and they found that 2 people who died in early February had the coronavirus. So it killed people in early February. Well, until yesterday, the earliest recorded death was in Washington, and it was in late February. So now they're saying, no, this is early February, the coronavirus is here, and it's been starting to affect people earlier than what we thought. And by the way, this is the way it is. I wouldn't be surprised if there's even earlier deaths than we thought about. And the same thing when China really investigates theirs, if they're totally honest about it, it's very possible there will be deaths related to the coronavirus, maybe in early November instead of late November, which is what they're saying. There's even one report I saw that said this virus started circulating in September. So still, there's a lot of back checking that's going on. Los Angeles just did an antibody survey, and they surveyed several thousand people to get a sense of if they've had the antibodies for the disease. And if you have the antibodies, that means you've had the disease, you survived it. And what they found was that there was about 4% of the population of Los Angeles County that had the coronavirus. 4%. That's a lot more than what they thought. That works out to be about 250,000 people. Their records only show 8,000 people have the virus, and yet, lo and behold, there's probably many, many, many times more than that. What that means is the virus is much more present, which means a lot more people have been exposed to it, which is good, which means that the likelihood of catching it and dying is not that great. But it means that there's still an awful lot of people who have not been exposed to this disease yet. And when they do get exposed, well, a lot of people will die. What virologists, people who study this thing, estimate is that about 60% of the population has to get the disease before a disease dies out on its own accord. We're a long way from that 60%. Okay? Okay. Just one other thing because we're running out of time. Yesterday, the U.S. Senate approved a $484 billion bill that includes $310 billion for small businesses. You remember the stimulus package that just passed? $2.2 trillion. Well, that money is quickly gone, and especially to small businesses. And so small businesses said, we still need more. And the government so far has responded. The bill is going to go to the House of Representatives on Thursday. The Senate just passed it yesterday unanimously. Now it's going to go to the House of Representatives. And if they pass it, then there will be much more help for small businesses. The sense is that this is still not going to be enough. This bill includes $75 billion for hospitals and $25 billion for more testing of the coronavirus. But the sense is that we're going to need a lot more than that. State and local governments are going to be desperate for money. Where do state and local governments get their money from? They get it from sales taxes. We're not buying right now. We're not out going to restaurants. We're not going to movie theaters. We're not spending. And as a consequence, state governments, city governments are not getting the money that they've had in the past. They have started to furlough people. They are laying off people. So that's all that's going on. So the sense is the federal government needs to step in. Federal government can do that because the federal government does not need to have a balanced budget. It can spend money it doesn't have, as we talked about in class. And so that's what the federal government's doing. $484 billion. So just to add it up, the US government has spent, because of this coronavirus, almost $3 trillion this month, basically, just to deal with this coronavirus. Okay, that's enough for now. That is more than enough. We're going to take a break and we'll be back on Friday.